Good afternoon, all. I would like to present our journey on tactile, which is a tactile marker on eye drop for patients with low vision. Imagine a visually impaired patient has been prescribed with 3 or 4 different types of eye drops. The biggest challenge here is identifying which drop to use now and how many times a day and how many drops. These patients always need someone assistance to administer their drops, makes them more dependent on caregivers, dropping their confidence, which may result in missed doses, medication errors, compromised recovery, and complications. And studies have documented cases of inadvertent use of both ophthalmic and non-ophthalmic eye drops, highlighting this as a significant issue. Many of our patients are struggling with the same issue, so there has to be a better way. So our question was, how can we create a practical and affordable solution to help visually impaired patients instill their drops independently? Our answer to this question is Tactile, which is a touch-based marker system on eye drop bottle for patients with low vision. Tactile basically composed of a label embosser machine, which is available in all online platform like Flipkart and Amazon for less than 1,000 rupees, and it is used to create raised numerical marking by pressing at desired alphabet or number. And this label strip roller is refillable to the same embosser machine, make it more economical solution. An embossed strip is one side sticky, is then attached to the eye drop bottle, and patient is trained to touch and feel the vertical lines, and the number of vertical lines implies the number of times the eye drop should use, and instead of this line we can press any numbers. For example, if we want our patient to put 2 drops at 4 times, we can press the number 2 at 4 times. And this is how we use it, the tactile system, making the embossed label marker by pressing at number 1 or the alphabet I, and cut the label by pressing at a scissors option, and it is attached to the eye drops. And the whole process will take less than a minute only. It is very time conserving process. So, for evaluating the impact of tactile, we conducted a study to compare the treatment adherence, patient satisfaction, and medication error rates between patients with standard eye drop application and tactile labeled eye drop applications. Our intervention group consisted of 50 postoperative VR surgery patients who received tactile labeled eye drops, and our control group consisted of same number of VR surgery patients who uses usual eye drops without a tactile marking, and patients with cognitive disorder affecting touch are excluded from the study. It was a prospective questionnaire based study which was conducted in a tertiary eye care center in North Kerala, and sample size was 100 postoperative VR surgery patients, and data collections was done within a period of 6 months. And patient is trained to use the tactile system within 1 to 2 minutes on the day of surgery, and patient feedback is taken by a structured questionnaire based on Likert scale at the end of 1 month when they are coming for their second postoperative visit. And questionnaire mainly consisted of 6 variables: whether they maintained correct dose and dosage, did they miss any dose, independent installation possible or not, how easy was it to instill the drops, how satisfied they are with their eye drops, and about the symptom improvement. These were the 6 variables, and result shows that 84% in the tactile group were able to maintain the correct dose and dosage against 60% in the control group. And there is less incidence of missed doses in the tactile group comparing to the control group. And 82% in the tactile group reported easy eye drop installation, Likert score more than 4. And most important good thing about the tactile is 78% of them were able to manage their eye drops by themselves. And there is little difference in the symptom improvement, but tactile group was still better, and overall mean satisfaction score is 4.5 out of 5 in the tactile group against a 3.2 score in the control group. So, Tactile is a simple and cost-effective scalable tool which improved treatment adherence, hence less medication errors. It promoted self-installation and reduced caregivers' load in post-operative VR surgery patients. And we also noted that patients with worse visual acuity benefited more from Tactile. So, concluded as introduction of tactile markers on ophthalmic medication enhances patient safety and reduces medication error among visually impaired patients. It promotes independence and thereby boosts their confidence. It has potential for smart integration and is suitable for widespread clinical implementation. We hope it brings smile on their faces. These are my references. Thank you.
Just one question from my side. How comfortable are they if they have to use more than one drop? If it's only one drop, it's fine. But if they have to use two to three medications, have you checked with them?
Yes, sir. Yes, ma'am. We can press the number 2 in labor embosser machine. For example, if we want our patient to put 2 drops at 4 times, we can press the number 2, 2, 2, 2 at 4 times, and the patient can touch and feel it. It is 2.
What if two medications have to be applied twice? I mean, the same dosage, BD, two the different medications.
Yes, ma'am. It can do. We can emboss the label marker on 2 medication differently, and patient can touch and feel it. Patient, they cannot identify which is this drop. They cannot identify this is antibiotic or this is lubricant, but they can identify the dose. The timing will be correct, and number of drops will be correct, but they cannot identify which is steroid, and we don't want to them to identify which this drop. Thank you.